All right, Alex, so I see for the evaluation we have next, this is a post-op total hip replacement posterior approach. We've been working together about 3 weeks now, and I think you're at the point where I don't need to be in the room with you. I can just kind of be available, line of sight, so in case you need something from me, I'll be right there. Does that sound okay to you?
That sounds good. What I want from this is pretty much, if you are okay with it, just kind of acting like a tech if I need it. And then because I'm not super familiar with patients like these, I just like some feedback afterwards on things I can improve on, or some things that you think went well.
Gotcha, yeah. So if you need some help from me on something like a transfer, I'll kind of just act like a tech, and you can kind of just direct me if that sounds all right with you?
That's good.
All right.
All right, Mr. John Doe, before we mobilize, I'm just gonna take your blood pressure real quick. You just relax this arm here, and I'll wrap it around, and then we'll get a reading. Kind of weird.
Yeah, so Alex, I think we should maybe try taking blood pressure again with this smaller cuff, given the size of Mr. John Doe's arm.
Okay.
Sometimes if you use a cuff that's too big, it can give you a falsely low reading. So
Okay.
let's go ahead and try that.
Thanks. Hi, Mr. John Doe. So we are going to be transferring out of bed. First thing we're going to do is sit on the edge of it. It might take a little bit, but we're going to get through it. I know you're in a little bit of pain right now. So I'm going to have you do as much as you can do on your own, but I will help you if you need it.
So,
I'm going to head
Mr.
over
John
there.
Doe, so we're going to be transferring this way, okay? I can help with your operative leg so you don't break your hip precautions, and we'll just go from there, okay?
All right, Mr. John Doe. So as you know, you had a total hip surgery. It's a posterior approach, which means they went through the gluteal bottom muscles. So they made
Alex, what are the precautions for a posterior approach?
Well, Mr. Doe, your hip precautions are
All right, Alex, let's go ahead and debrief that session we just had with Mr. John Doe. In regards to the supine to sit transfer, how do you think that went? Is there anything you would have changed or done differently?
well. I wanted to assess his strength deficits at first, but after the first attempt, I realized he was going to need a lot more assist than I thought, and I wasn't exactly prepared for that. So if I had to change, I probably would have prepped a little more in case he needed more assist. But I mean, on the second attempt, it went okay. So I just would have changed my first going into it.
Yeah, I think that's a good reflection. All right, Alex, let's go ahead and debrief that session we just had with Mr. John Doe. I'll just come out and say it. I would have used the leg lifter during the supine to sit if I was in your shoes. And I don't really understand why you did what you did. Can you walk me through that?
Yeah, so I didn't use the leg lifter because I wanted to assess his true leg strength and his impact on functional mobility. If I would have used a leg lifter with him, he would have used his arm to move his leg, and I couldn't actually assess how well he was moving it in bed. Does that make sense?
That makes sense.
Okay.
All right, Alex, so in reflection with that session with Mr. John Doe, I thought it was really interesting the outcome measure you chose. Can you kind of walk me through why you chose that?
Yeah, it has really good psychometrics and is well established in this patient population. So I thought by using it, it would be a good way to track his progress and actually be applicable to him, even though most people haven't heard of it.
Yeah, it sounds like you made a good choice. In all honesty, in my own clinical practice, I do not use outcome measures enough, so I applaud you for taking the time to really think through what measure would be best for Mr. John Doe. But yeah, it's just something that I don't incorporate as much. It's really beneficial for writing goals and showing change over time, and that's something that I would like to improve on as well. So if we can spend more time with you, maybe walking me through how you chose that measure and what are the certain aspects of it, I think I would really enjoy that.
Yeah, I'd love to. It's a really cool one.
All right, Alex, so I would like to give you my feedback on what I saw during that session with Mr. John Doe.
Okay.
So from the very beginning, I thought you established good rapport with the patient. I think they were confident in you, and I think that really showed throughout the session. Something I think you could improve on, especially given that he's a post-surgical patient, checking the incision a little bit more closely, assessing sensation around the incision, checking for an infection, things like that. I think that's something that you maybe could have spent more time doing. But overall, I think it was a very good session for your first post-op surgical patient. And your soft skills are really on point. That's fantastic. We can really build off of that, and I think you'll pick up on the more procedural aspects of caring for post-op patients over time. And so I really have no concerns for you.
Thanks. I agree that I definitely need to work on the observing the surgical site. Like you said, I'm not used to it, so most of the time that's not even registering in my head, but I agree. I'll keep that in mind for the next time. But thanks for telling me what went well. I appreciate that. It's good to know things to improve on and then what also is going good. So that sounds good. All right. It's supposed to be.
Okay. Act like I'm out of the room. Can't see.
Good? Okay. Alex.
Oh,
Proof
Alex.
that you just failed this question on your own.
By the way. All right, Alex. So, okay. Okay, I'm sorry. We gotta get the giggles out.
I'll clip it. Okay. This is so awkward. Just don't look at me. Look like
won't.
out.
Yeah.